So I think we have a great opportunity now for the next half hour or so to engage our speakers in a panel discussion about many of the interesting issues that arose. I think because it's only half an hour, I am going to go ahead and invite people to come up to the microphones if they choose, although like Doug Deacon, I have some questions that I want to ask as well. So if you have a question for the panel, please feel free to come up to the microphones. I think I'll just start with, Jennifer, I think you in your slides talked about whether or not there was a higher moral obligation for physicians to think about how they did or didn't use social media compared to other professionals. And so I was wondering if you could expand on that and maybe compare it to, say, teachers in education, and whether you think there are different ethical issues involved in how people might use social media.
Right. So I think, great question. I think that there are both risks and opportunities for physicians that are different than exist for professionals in other fields like education or an attorney or an accountant. Some of the risks are that, I was saying to someone during the break that it's perfectly normal and natural and only human for an individual to sort of go onto Facebook and say, on my way into work, didn't get enough sleep last night, or had one too many glasses of wine, or kind of dreading it today, not really in the mood. And if you're like a tax attorney, that might actually be fine. Maybe it's just my bias, but that sounds pretty boring. But I think, if you're friend, but if you're a physician and your patients or your patient's parents are friends with you on Facebook and can see that, and you're on the way in to take care of their child, then it creates it has new meaning, and it has risk to that kind of reflection and sharing will have risk that wouldn't be true for individuals in other professions. But on the other hand, as Wendy pointed out, there's enormous opportunity and richness there that can really enhance the physician-patient relationship and make work better and make you more effective as a doctor. That also might not be true for the tax attorney. And so I do think that there's a sort of ethical imperative to explore that and work on getting to a place where we can have physicians online and electronically communicating with patients in a way that minimizes risk and optimizes those benefits. So I'm not sure that we're there yet. I think that and I don't think that writing a bunch of policies is the way to do it. I think it's just through education and through kind of combined collective experience with these different media that will allow us to get to that place. But it's definitely, the way to go.
Wendy, you see?
Yeah, no, I just want to say, I agree that we're not there yet, and I think ultimately it isn't that I'm saying you must be on Facebook or Twitter, right, that's the tool. And I think we're in the very early genesis of great electronic communications. I mean, one of the ways that I really believe that we will reduce waste in the health system is by not using patients as billing code vessels, right? The only way we get paid to see pediatric patients in an outpatient clinic is if they're in the clinic in front of us, and we bill by time or by complexity. In the future, of course, we will do more what the integrated prepaid systems are doing, like Kaiser and Group Health, where we'll have electronic visits. We'll have Skype-like visits. So there are companies that are being built in Silicon Valley right now that are really looking at, can you get on a video platform and ask a 1-minute question to your physician? And can I get desynchronously, so maybe 6 hours later, get on and answer you back? And can that be part of our visit? That, of course, the physical exam is relevant, and part of our responsibility is triaging and knowing when and where. But we aren't there necessarily. I think the patient population is genuinely there. They're researching, they're data mining online, they're sharing what they know, they're coming in with a wealth of information. Most of it is very certain in their mind. And these networks, alluding to even the study that was published earlier this week, are crucial to families' survival and understandings. And we don't have to police those or always be present, but I think we need to start using these tools and interacting in the way that the world is interacting to really keep pace and ultimately succeed in providing medical homes.
Great. Mithya, you want to ask a question?
Yeah, thanks. So my name is Mithya Lewis-Newby, and I'm one of the cardiac ICU attendings here at Seattle Children's Hospital. We've talked a lot about doctors being on social media and the harms that might come to us and to patients, and we talked a little bit about going on to into these social media sites. I am so not internet connected, I don't even know the right terms, but anyway, onto these social media sites and learning about our patients potentially. So I think someone mentioned, well, maybe you could look for suicidal ideation in some of your adolescent patients, something like that. We had a case in the cardiac ICU where we had a patient who was there with us for the better part of a year, a very complicated ethical case of a family who declined cardiac transplantation but wanted everything done. And they had a blog. And I'm one of the last people of my generation who's not even on Facebook, I think. And, so I barely answer my email. But nonetheless, they had a blog. And after many months, I thought, well, I'll just go see what their blog is about because everyone was talking about it. And it was interesting to read about it. They wrote a lot about individual physicians and nurses, and they wrote about their understanding of things that I maybe had just told them yesterday, which weren't necessarily accurate in what I intended to transmit to them. And I was left feeling, I know it's public information, it was there, it's out there, but I was left feeling that information wasn't really for me. I wasn't intended to be the one reading that, and it was somewhat private information. And then it made it very confusing about when I did go to talk to them, was I supposed to respond to the stuff that they had mentioned on the blog? And then I think it also wasn't entirely therapeutic for the relationship. They were there for 9 months. There was a long-standing relationship with all of the nurses and the physicians, and everybody had to take care of this family. But I don't think that in the end, people reading their blog contributed to an improved therapeutic relationship. Because of some of their complaints of some of the things that we did, obviously. So I don't know. So should there be restrictions on us going to patient blog sites and reading, or should we be obliged to, or how do we answer those? It didn't feel right to me, but I don't know why.
John?
I mean, I guess it seems like with all these things, finding the right analogy is crucial. So a Facebook page is more like a private setting and that you have to be invited in. A blog, I think, is more like a letter to the editor or something, where they are putting it out there in the public domain. You read it. I don't think you violated their privacy by reading something that they put on the internet for public consumption, but what you should do about it is complicated. So my gut reaction on that case was, wouldn't it be nice if you knew they had a blog to say to them, so I hear you have a blog, would you mind if I read what you're writing, and responded? And then that would give them the opportunity to say yes or no.
Yeah, I mean, I actually, it even sounds more like you're reading their diary, right? I mean, I think sometimes people blog that way. I think, I have a very close friend who has stage 4 colon cancer who's blogging through her experience, and she uses it 2 ways. She uses it for therapeutic, just getting things out about her struggles, but she uses it as a very efficient way to update all of her friends and family of how she is, right? And, your venture into that world certainly it clearly affected you in a negative way and maybe didn't enhance your relationship. But I ultimately think it's like everything. The more transparency you have, the better, where you can ask about it ahead of time, and if you stumble upon something you didn't expect, you can say, wow, that really surprised me. I can imagine that this is overwhelming and that there can be miscommunication, but I'm going to really work at being present with you here, right? I mean, you just have to that's your limit. You didn't want to be there. It didn't help you. And it may be very different for a colleague of yours.
I think in time we may get better at being more upfront about the fact and more explicit about the possibility that our patients may blog, and be able to say, look, if you choose to express yourself that way, I hope that you will also just share with me in our time together, those same types of things. I can also go read your blog, but I hope that you'd feel comfortable to come to me, with those same things so that we can talk about them together, or something along those lines, so that, they know that it's sort of a two-way thing, that you can meet them on the blog or they can meet you with that same content in the exam room, and that you're open to both.
But that's so personal. I mean, I ultimately don't know that. I mean, I agree that someone asked me at the break if I thought it was icky to be friends on Facebook. I'm not friends with any of my patients on Facebook. I don't know that I think it's icky, but in general, I think these tools can be used. I mean, I take such an advocacy education point to it. I don't know that it has to be that intimate in the sense of your interaction online with patients. I think it can be much more using what you know in your leadership to prevent injury and provide cure as best you can. But
Or the other thing in your story would be, you could say to them, when you put things on a blog, anybody can read it. Did you know about Caring Bridge, where you can do the same thing just for the people you invite to read it? And then you'd find out whether they wanted you to read it or not.
Yeah, and they could have privacy protected it. It's very easy to privacy protect a blog.
I think the other piece that I think of related to examples like that relates to one of the things you said, Wendy, is the potential for conflict and miscommunication about challenging issues with social media and the internet. That can happen without any internet and social media. But you were talking about some of the communication around those families who had children die of sudden cardiac death and were very offended by the response to the New York Times article. John talked about some of the autism stuff that's going on. Do you guys have a thought about either the role of individual physicians in using social media, or more broadly, where are the boundaries where sort of conflict should or shouldn't be addressed? I mean, it seems like an opportunity for education, but also an opportunity for misunderstanding or inflaming of emotions. I don't know, Wendy, it sounds like you've had some personal experience with people being quite angry at you through your blog.
Well, right. And I mean, it's in some ways shocking how much I've been insulted, and then when you use media as your tool, you get so much more attention than you want as well. I mean, it's been a really bizarre experience for me. I can get absolutely shaken from things that people write to me. I can get absolutely inflated, right? Like I have to work very hard to stay in the middle and say, what's my obligation and what's my mission statement and what am I trying to do here? That's really powerful for me. Why am I writing this and what am I doing? And when someone comes too close, so people on Twitter ask me personal health questions all the time. I always decline to do that. But I can use that information to realize, there's just misunderstanding about this. So two people ask me about something, I realize that's a great opportunity to curate a tweet where I lead them to an article that answers the question, and if they're following me, they can find that. But I think this is where we do use instinct very powerfully. If something doesn't feel right or is uncomfortable, you can very clearly say, we need to take this offline, or you need to see your pediatrician, or we need to talk this in another space. Now, Dr. John M., who put his opinion about a very controversial issue surrounding universal EKG for cardiac death, he was mortified, and yet still recognizing that although he was being broken, it was kind of Tanya Harding type shin breaking, and yet he ultimately knew his voice was still very important in the conversation. Just like when someone's disappointed with the kind of care we provide or the answers that we give them. I think
So I'm sorry, just because I'm not familiar with it, he was getting broken. Was it because they were disagreeing and posting pictures of their children, or was it they were making personal attacking statements?
So much. I mean, he couldn't believe that families were posting their dead children's pictures on his Facebook page. I mean, it was a Sunday morning, and he was trying to get me immediately because he was mortified. He was hurt. I mean, it's like the physicians at CHOP. I have a little bit of that backstory, but when they declined this kidney transplant and were misunderstood.
Allegedly.
Right, excuse me. Thank you. Thank you. Thank you. I think they were mortified, but I think the lesson is really this, that, of course we should Google ourselves. We really should. It's not vanity, it's knowledge. And if you don't put any content out, it is by far negative content that will drive your search engine optimization. When someone looks for Karen Johnson, MD, if you put nothing out to the world about what you know and who you are, even just a LinkedIn Facebook or a LinkedIn profile, that says the passion with which you go to work and the problems that you want to solve will bubble up way above that. So we can take that lesson and say, from CHOP, and say, if you're a Department of Transplant Medicine, you can go out and say how complex it is to make transplant an organ, or how much, what a procurement really is, and share some of that insight, and you will start really changing your ability to drive health reform and have people understand who you are.
But I think the point that controversy drives traffic is one of the differences between being a professional or semi-professional blogger, where one of your goals is to drive traffic to your website. And so a little bit of controversy is a good thing.
Depends.
Yeah. Versus a Caring Bridge page, which you're using to update your family and friends about what's going on, where you're not courting controversy. That's not the point.
Yeah, I mean, and I've observed in the space where, a lot at children, sometimes I'll write a blog and I'll say to, people can get quantitative results are very important to people. Like number of views can be very important. And my belief is ultimately, if the 5 right people read the blog, you don't need 5,000 views. If it's, and I think that controversy is what happens, and I've watched bloggers go from hospital systems and clinic sites to the Huffington Post, for example,
right.
And the content completely changes.
But I think
Yeah, it has to.
one of the interesting things about that, I think also for the more professional blog, whether it's a hospital or an individual, is the idea also of how a dissent is appropriately managed and discussion about dissent, strongly dissenting opinions. When does it cross the boundary into inappropriateness? How can the discourse in the public space be seen as a positive opportunity where even the minority can express a dissenting view that may or may not be grounded in scientific fact, but that can be create an opportunity for discussion. So that's really interesting. Yes.
I'm Tord Hansen from the University of Oslo, where I also chair the Clinical Ethics Committee for the Oslo University Hospital. And I'd like to draw attention to a couple of concerns that was raised with us by a group of nurses caring for young cancer patients from whom they received requests for friendship on Facebook. And there were two concerns that I think merit consideration. The first is that those of us, and I'm a neonatologist, I've spent the better part of my professional life caring for desperately ill babies. Sometimes you don't succeed. That hurts. You can go home from a night on call and feel emotionally wrenched. You need respite, you need rest. So, my observation is that social media very often also occupy a significant chunk of people's free time. So where is your rest and respite going to be if you are also going to deal with the same issues in the afternoon that kept you up all night? I think I could not do a proper job for my sick babies the next day if all of my afternoon and evening had been spent wrenching my heart over the same issues. So that's one thing. I'm also a husband and a father. My wife and my children also deserve and indeed own part of me. If all of my soul and attention during those hours, and I, like most doctors, work long hours, if during those hours that I'm with them, my attention is directed elsewhere, that can also have negative connotation, not just for my life with my family, but eventually for how I perform as a physician. So I think those are important concerns. The other thing that we were concerned about, that I am concerned about, is what does this do to our thinking about who is a friend? Now, in my age, I currently have dear friends who are battling with serious, potentially fatal illness. That hurts, because I care about them. And it's not that I don't care about my patients, but my caring for and about my patients is qualitatively different from the way I care about my friends. So if I befriend a patient, or in my case, the parents of a patient, on social media, now what if I should happen to get a question which I assess in a way that turns out to be unfortunate? How am I going to carry the burden of that? And not to say, if my Facebook friends, for instance, in the case of these nurses, a young adult with cancer eventually succumb to their disease, which, as we know, they sometimes do. Can we survive as health professionals if all our friends keep dying? Just a slight exaggeration. So these are, I think, very significant concerns relating to how we as health professionals, nurses, physicians, other health professions, elect to be part of the social media scene. And I'm not being negative. I certainly see all the positive potentials. In fact, I also curate the teaching site for medical students at the University of Oslo in pediatrics, so I'm well aware of all the positive potential. I just think we need to be very considerate in the way that we involve ourselves and look at the potential ramifications of our involvement.
Yeah, I mean, I appreciate all those comments, and thank you for sharing those with us. And I agree with much of what you're saying. I actually, in preparing for this talk, I sort of refreshed my lit search to see if there was anything new. And one thing that I didn't have time to include that I found was a recently published article about a group of investigators who developed a screening tool for Facebook addiction, to like try to figure out who's addicted to this, because it's a phenomenon of people, of limit setting, that, you know, once some people can't quite detach themselves from it. And so if your workspace is part of that, then aren't you sort of addicted to your work environment, and what does that mean for the other domains of your life? And so particularly in a field like pediatric oncology with that emotional intensity, I can see where that could be damaging. I mean, I think that there is the possibility to have more than one Facebook account, so that you could have your personal Facebook account where you're friends with your actual friends and your family members that you use for social purposes, and another one that you have as Dr. Smith that allows you to interact and kind of expand your professional space into the electronic medium, and that would be a Facebook page that maybe you would make clear to people that you would not be on at all hours of the night and during your personal time, and that you would only access it during business hours because it's part of your business. And I think that kind of limit setting is probably going to be important. But, you know, I think that there's certainly, you know, caution to mention in the way of excess, but as we've been discussing, on the other hand, if you don't take the risks in that direction, you don't get the benefits and, you know, access to the promise that this also has for us. So it's sort of a balance.
And there was, I appreciated your comments too, but there was sort of an idea in them that Facebook is after you, that you can't not be on. It's going to pursue you home. But that's a different question, I think. I mean, you could say it's appropriate to do from 8 to 9 every morning, for these nurses, say, to talk to your friends, but not to do after you go home, if you thought it was appropriate ever. It wouldn't necessarily have to take over your non-working hours.
Well, and I also think you're talking about the holy grail, which is work-life balance. And,
Right.
you know, we as a profession do a terrible job. And I think compartmentalization I'm not very good at it, but I'm working at it. And I think it's very key for having time, like I mentioned, for the 3 marriages that you want to maintain.
You may need to look at that screening tool, actually.
I don't use Facebook very much, though. It's Twitter.
Yeah.
They'll get one for that next, and
Yeah, no,
then you'll be all
totally,
set.
totally.
Yeah. So, Doug?
John, I agreed with you about it feeling icky to friend a patient, but what about the other side of the coin, which I think is more common? I think nurses and physicians get friend requests from patients, and I'd be interested in hearing what the 3 of you have to say about how you should respond to those, and if the answer is you shouldn't be friends with patients at all, then how do you handle those requests in a not so awkward way?
So I get them. I decline them. And I just state that, you know, the relationship that we have, I provide as much content online as I can and as much information as I can, but I don't provide any personal medical advice outside of the public sphere. So on the blog, for example, I wrote about toddler sleep, and then I'll get 40 questions about their kids not waking, sleeping, you know, like all these questions. And I do my best, because my belief is that it's just shared learning, that families will have the same problem as we know. They're kind of typical things that happen with sleep for families. So that there's just a lot of learning there, but so I always decline them.
Yeah, I think just having a policy, or people have talked a little bit too about having a professional page and a personal page, but to say on your personal page, have an automatic message. I do not respond to friend requests from patients. I mean, it's sort of, to pick up on an analogy from the earlier session, I mean, what would you do if all your patients were asking you to sleep with them? I mean, it's just...
I know.
I mean,
I would
they
just like to
really
say that-
want to. I mean, does that mean I have to? No, you just say no.
I think the reality is that they come very infrequently. I mean, I think, you know, I've got thousands and thousands of people on Twitter but I've only been asked a couple of times to be a friend with someone on Facebook. It just doesn't happen very much, even though I've made myself really available to people.
I think institutions are helping with this a little bit too, because many institutions are creating policies that say that this is heavily discouraged, so it allows clinicians to say, you know, I'd love to, but we're not allowed to do that kind of thing, you know, and it kind of takes some of that personal, you know, feeling of worrying about insulting someone or having to be polite kind of off the table, which I think is helpful for the clinicians.
And I think that's true for other kinds of friend requests from non-patients as well, that certain filters either are or are not applied for all kinds of requests, Facebook
Right.
requests or other requests like John was
It's sort of
mentioning.
like, it's not you, it's me, it's like that, but for,
Yeah.
for Facebook.
Yeah. I think we maybe have time for one more question. Yes? I think
Yeah, I
you were
just
waiting.
had a comment and a question, and the comment has to do with the Facebook. I agree with having a personal, and if you're going to have a professional, have it professional. I think for nurses, the challenge is, you know, can you do that through your hospital's Facebook page in some way? Because it becomes a scope of employment issue when you have it done professionally. But are there any concerns, and I know one article I read had concerns about the information that Facebook culls from people accessing and friending you. So, and they collect data about these people. So do we have an obligation as healthcare professionals, and when people are logging into Facebook or inviting them as friends, to kind of be at least aware that there is some for-profit entity that is collecting information about our patients and directing advertising toward them that may not be beneficial for them?
Again, much broader set of concerns, not just Facebook, but every time you go online. So,
But it is specifically for Facebook. That's right. That's why they hope to make
That's why
make
it's
it on Wall
free.
Street.
Yeah, sure.
but when I searched hotels in Seattle, suddenly I started getting ads from hotels in Seattle.
You do, but your patients don't. So the patients that are friending you, do we have an obligation to be thinking about the impact this may have on them, especially if they're minors, you know, emerging adults, or emerging autonomy as young adults?
I'd add that to the ickiness.
Okay, well, I think we're about to transition now. Thank you. Join me in saying thank you to our panelists and speakers.